Good morning, everyone. My name is Dr. Madeline. I'm a board-certified OBGYN and medical epidemiologist. Thank you so much for joining me today on Facebook Live. I know that there's so much going on. We're also continuing to navigate this COVID-19 pandemic with everything else that's going on in the world. So I wanted to just take a few minutes this morning to talk with mostly pregnant women and those who support pregnant women about a couple of things that may appear different as you're navigating your pregnancy at this time, and again, for those who support you and love you as you navigate your pregnancy. So things may be different for your labor and delivery process depending on where you are in the country. Some cities have, if you've been watching some of the news reports, this pandemic is very much about following a curve. And some places are in the middle part of that curve where they're still trying to pass their peak and see cases come down. Other parts of the country have passed that peak and are looking at a strong recovery. For those of you who are visual learners like myself, this is what we mean by the peak. So cases kind of creep up and then they peak and then they come down. Some parts of the country have already passed that peak. New York City is a great example of a place that's past the peak and where things are happening differently for pregnant women. In some parts of the country, like where I am, we're at more of a plateau. So we've seen a gradual increase in cases, and then we're just kind of hanging up here at the top. We haven't really started to come down yet. So that's important to know because in terms of how we're approaching things when pregnant women come into the hospitals in labor and delivery, it depends on what's going on locally. And so it's really important that pregnant women, that you speak with your OB care team so that you'll have an understanding of what's going on locally. And this is important because many hospitals in different areas are doing things a little bit differently. And I want to just touch base on those things today because it's a conversation that we're having with many of our pregnant ladies, and it's important that if a pregnant woman, if you're not aware of these things or what the changes might be, it's important that it be on your radar so you and your OB team can have a conversation. So two big things might be different when you either present for delivery, either in active labor or for a scheduled repeat C-section. The first thing that's going to be different is that most hospitals, depending on what's going on where your local area is in that curve, most people are doing a COVID-19 swab when you come in for admission. That's if you're in active labor. If you have a scheduled C-section, then usually that COVID-19 swab is done a few days before your scheduled C-section. Having that COVID-19 test allows your OB care team and anesthesia team to take better care of you and be able to keep you safe, your baby safe, any person who might be joining you in your labor and delivery process, to keep everyone safe. And it helps us also prepare, if your test is positive, to have adequate personal protective equipment, or PPE. So that's the first thing to be mindful of, that depending on where you are, and I tend to practice mostly in the Atlanta area, most hospitals are screening, testing ladies who come in labor for COVID-19. A second thing to be aware of is that things are different right now in terms of how many people are allowed to join you. Right now, you're allowed to have one support person who is with you from the time you come in labor to the time you go home. That person is allowed to go in and out. Most hospitals allow that person to go in and out sometimes, but not too much back and forth. Again, the goal is to keep the mom, the pregnant woman, the baby, everyone as safe as possible, and as well as your care team. So I also, before I close, I want to address one myth that keeps coming up when I see patients in the office, and that myth is about having the test, the COVID-19 test, actually gives you COVID-19. And that's this notion that that by having the swab done, when the swab goes up into your nose, some people believe that in some instances they're being given COVID-19. And so I certainly can understand why people are concerned about that. You know, as people of color in this country, especially African Americans, Hispanic, Latinos, we have a long history of medical mistrust and not really understanding why some things are happening in the way that they're happening, especially when people look at what's going on. They see that COVID-19 is so disproportionately affecting people of color, especially Black Americans, especially persons who have underlying medical conditions. And so What I do want to say is that when that swab is done, it comes out of a sterile package, and that swab is a swab that's only used with you if you're going to have a COVID-19 swab. And once that swab goes into your nose, it goes back into a sterile container, and that container is taken down to the lab. I'm not aware of any instances where actually having the test done has given someone COVID-19. Many of our ladies who are being screened now at this point in the epidemic in the Atlanta area are actually screening negative. We have also found that among persons who have no symptoms, screening positive can be as high as 12 to 15%. So that's one of the reasons why the screening is done universally, to try to be able to appropriately manage those persons who may not have any symptoms but who may screen positive. So I hope this was helpful in answering some of the questions about what might be happening differently for pregnant ladies as it relates to COVID-19. We're still in the midst of this pandemic. I want you guys to continue to stay safe, continue to wear your face mask when you're out in public, continue to wash your hands, try not to touch your face, and absolutely, take care of yourself, stay safe out there. And again, most important, don't forget to talk to your OB care team. Thank you so much. This is Dr. Madeline signing off.